Guys, thanks for showing up today. I'm Michael Marks. I'm a nurse practitioner. I'm the senior advanced practice provider at Biden-Duplin ER, and I've run my own practices, and I've been a nurse for 20-some years now. Okay? And I have a question for you guys first. I like to run around the room. I like to talk, and my wife says, "Don't say something," because I say just like wait at me or something, because I say so much. But anyway, why are you into nursing? Why are you going into nursing? Who wants to start? You may like that.
It's when you just mash that
well,
button. I did
out
until
as
I was
a
hearing this
therapist,
going.
and
I don't have my glasses.
Yeah,
It says record.
Okay. All right, we'll go right around the room. I'll be mean.
I've been in the healthcare field for almost a decade now, and I think nursing kind of opens up a lot of opportunities for me.
Okay.
I got a bachelor's degree in social work, and I like the whole patient care and getting to know people, but I like the more medical side of things.
I'm a people person. I just like being able to have knowledge to help others.
To be able to help people and pretty much work just about anywhere, any area.
Pretty much the same thing, being able to help people and having a wide variety of opportunities for work and jobs and advancement.
Yeah, I agree pretty much with that. I mean, you have so many opportunities you can take it so many different directions.
That's why.
So,
Okay.
yeah.
Same thing, working with people and high demand.
I always been interested in the medical field, and I like the direct patient care that nurses do, and I like all the opportunities and different areas nurses can work in.
I just figured it'd be kind of fun.
Alrighty.
I didn't want to go to school for like 12 years to do like a psychiatry type thing. I want to do psych nursing, so I like being one-on-one with the patient, but treatments and talking things out and stuff like that.
Okay.
I want to be able to help others, and I like the opportunities and all the flexibility that comes with nursing.
Yeah.
I've been in the medical field for about 10 years also, and nursing, there's just more opportunity and I can better take care of my family.
Good.
My mom's been a nurse my whole life, and when my son was born, we spent 2 weeks in the NICU, and the nurses really made it a much better experience for me, so that's when I really got interested.
Okay. Well, nurses. Alrighty. This first line up here, when you're 93 and have congestive heart failure, you shouldn't have to beg for the salt shaker. That was the title of a lecture I received from Kathy Canzona, Dr. Canzona, one of the best nursing professors I ever had in my first year of nursing school. And I've never forgot it. And I don't think anything will ever sum up what nursing is all about than that sentence. I mean, I get chills when I read that. That is the essence of what we do. We care for people. So, with that said, let's go on ethics, code of ethics. Every few years or so, nursing comes out with a revised code of ethics. And last year, they came out with the latest one. And I'd like to talk to you guys about that. You were the right stage in your education to start thinking about that. All these reasons we talk about for doing nursing are all part of it. Wonderful reasons. And but there's a reason why there's so much opportunity, so much that you can receive from nursing as well as give. And it all comes down to, or part of it is the ethics. So I say, welcome to the world's greatest profession. I truly believe this. You get to do so much good. It is so rewarding. And here are the current statistics. For the 15th year in a row, the Gallup poll shows the American public rates nursing as the most honest profession, and nurses as having the highest ethical standards. That's crazy, isn't it? 15 years in a row. This is what people think of nursing, and why is that?
Excuse me. Did you get it?
We got it.
You did?
We're good.
Okay. Thank you so much.
Thank you. So it's just remarkable, and so welcome to this, and I hope I can help you a little bit today with a little bit of focus of the hows and whys. Pretty interesting, the current ones. There's some new things in there. Have you guys seen them yet? Yes. All right, provision 1. Nurse practice with compassion and respect for the inherent dignity, worth, and unique attributes of every person. That's a mouthful. Every person. What's that mean to you guys? Feel free to join in. Everybody's already spoken once. I'll tell you how I interpret this. You have to treat everybody as an individual. And every patient is different. And if you get to the point where you just see the same patient one after another, and not look deeply into what they're all about, then you're going to lose your compassion and lose your ability to truly care for that patient. So I hope you discover this and never lose it. I still have it, and I hope I don't have it. But you do hear about burnout, and that's one thing about nursing is that you can go to so many different areas of nursing, so many things you can do. I tell people, younger people, you should go into nursing. You know, I don't like blood, I know so. In nursing school you might see a little bit of blood, but you know, there's so much in nursing. A psych mental health nurse or nurse practitioner. You don't see much blood there, but you do an awful lot of good. Number 2, primary commitment to the patient. Whether an individual, family, group, community, or population. Alrighty? What's this say to you guys?
Our number one priority is the patient.
What's that? I'm sorry.
Our number one priority is the patient. And whether that, sometimes the patient goes as far as the also caring for or answering questions to the family.
Okay.
Or in a group setting.
Alright, anybody have any examples of something like that?
Children, parents and children.
Parents and children? You have to take care of both of them. Anybody ever run into parents that don't want to give their kids immunizations? Have not run into that? Okay, what do you think about that? I see some nods and looking about this. What is your obligation as a nurse? Your patient is a child, the parent doesn't want to give them an immunization, and who's your responsibility? Individual, family, group, community, population?
All of them. All of them.
All of them. So what do you do?
Educate the parent. Educate the parent on why it's needed, what it can help prevent.
What could happen if they don't get it?
Ethical responsibility. Okay? Makes me angry. To me, the child abuse is that simple. And it risks to the population. Your duty here is to the population. What population are we talking about? All kids, all the kids in schools. I had a long conversation with our local elementary school principal. She's extremely frustrated about this. So your responsibility in the immunization is the child, the parent, your community, and the entire population. Okay? And this crosses so many areas in nursing. All right, number 3. Promotes, advocates for, protects the rights, health, and safety of the patient. Well, there's one we just talked about. How about some other examples?
I had an elderly patient yesterday that they were expecting him to pass and they were wanting to transfer him to hospice. And he had just started having pain, so of course it was time for him to get morphine anyways. But the ones transferring wanted to intervene and go ahead and just get him out of there. And so, you know, with the family there, I told them they need to give him more time for that medicine to take effect because he was in so much pain.
Okay.
You know, so even though he's, you know, passing away, they're thinking, but still, you know,
There's still
he's still here with us right now.
Absolutely. Absolutely. Any other situations you might think of?
When you have a patient, like she was saying, that's getting ready to pass away, and they're kind of telling you that they don't want anything else done, but the family is so wanting to do everything that they can do. That's another situation. You have to stick to what the patient wants.
Absolutely. Very common occurrence, too. Very frustrating. It's the emergency why. Okay. Absolutely. What about in interactions with other people in the healthcare area? Like suppose a a doctor writes an order, or a PA or a nurse practitioner writes an order that you feel is not good for the patient, what's your obligation? What would you do?
Question it,
Hmm?
question it.
And who would you question it to?
The provider.
Hmm?
The provider.
Okay. Do you have the right to say no to a physician?
Yeah.
Absolutely. Absolutely. It's tough as a young nurse to say that. No, I'm not going to do that. No, I really don't think so. This is why. I can't do that because of this. Make sure you know what you're talking about. Make sure you understand your role and rights and professional roles of your nurse. But you need to do that. Many times, I worked in a large academic medical center, and we had residents when I was a nurse. Still, I'm always a nurse, I'm a nurse practitioner, but when I was practicing nursing, that's why it's called a nurse practitioner. I explain that to people. I'm getting nods from the back of the room. Yeah, we do think, well, I'm a nurse practitioner, I'm not a doctor. Although I will have my doctorate soon, but that's not an idea. Know your rights. I know that more than once I told a resident physician that I don't think that's a good idea. This is why. They persist. I said, I really think you need to talk to your attending about this. And if you don't, I will. And that's not going to, I'm not going to do this. It's not going to happen. And this is why. Make sure you can articulate why. Just don't be nasty, although you want to be. So you're a nurse. You're with the patient all day long. They've been there for 5 minutes, and they don't really realize what's going on. That happens. And that's your job and obligation as a nurse. Any other examples of this? There's a lot. There's so many things to do. Okay. This ties right into what we were just talking about. Okay. I like to talk about accountability. Okay, you're accountable for what you do. Okay. The doctor said to do it, so I did it. That's like the Nazis. They told me to kill them, so I did it. Okay? If you recognize they're wrong, it's your obligation as a nurse, and you're held accountable. It's your license, and you are licensed. Really straightforward, but you have to know your nursing. Learn now. And once you graduate, you're just getting started, just know enough to really enter into the profession. Promote health, provide optimal care. What is health and what is optimal care? What about the dying patient?
Keep them comfortable.
Hmm?
Keeping them comfortable and respecting their wishes.
Okay. I have too many stories. I don't want to tell too many, take all your time today. I'm with the National Disaster Medical System. I deploy all over the country to disasters. When they occur, and in the aftermath of Katrina and Rita, we were in East Texas on the border, and we ran into a nursing home which had no power. It was 105 degrees out there, and there was no place for them to go. And we actually had to admit these patients to a local hospital, a local kind of community hospital we took over, and then write transfer orders and send them to hospitals away from the disaster zone. Most of these people went to Dallas. But these people were deathly ill, frail, elderly, skilled nursing facility patients, and some of them were dying. We had made the whole waiting area, the admission area of the hospital, a ward to admit these people. But you just can't send them to a hospital without orders. So we had to write admission orders and write discharge orders. But there were several that we knew were going to die, would never survive the trip in the back of an ambulance, 200 miles to Dallas, Texas. And so we made nice little comfort areas there. And we did not allow them to be transferred. We did not write transfer orders. We gave caring, nursing care to these patients and allowed them to die in peace and made them comfortable. And that's the type of thing that nurses do. The three of us who were there writing orders were all nurse practitioners. And we're not sending them. And we had skilled nurses there. And we all agreed, no, we will not send these people to the hospital. And that's optimal care. We didn't try to prolong their lives. We didn't try to dump them on somebody else to die someday. We took care of them. And that's optimal care. All right, here's a biggie. You owe the same duties to yourself as to others, including responsibility to promote health and safety, preserve the wholeness of character and integrity, and maintain confidence and continue personal and professional growth. That's a mouthful, isn't it? What does it mean?
Keep
Somebody else.
yourself healthy so you can take care of your patients.
That's right. You can't take care of yourself, then if you're not taking care of yourself, then you're in no shape to take care of your patient. Absolutely right. I like to extrapolate this to tell family members when their family members are deathly ill and they're exhausted, everyone's else bragging while they're in the hospital under care. They say, no, it's my turn to take care of them. You need to rest so you can be healthy and strong to take care of them when it's your turn. Now your turn right now. It's interesting about talking about professional growth. Once you're a nurse, you're not done. You're just getting started. It's non-stop education. I swore 19 years ago when I got my master's, I was done with school. Now, I'm in the doctoral program now, so it's never over. Okay? Never over. Character integrity, sometimes you don't want to take the easy way out. Oh, it's almost shift change. I think this person does some kind, and I've been cleaning them up all day long. I'll leave it to the next shift. No. And there's so many, there are myriad things like that. You just want to do that. I turned them 2 hours ago. I don't think they need to be turned again. The person with the cubitus ulcer, 3 hours is okay. No, it's not. And that's, you just have to have that integrity to do what's right for your patients and yourself. Recognize when you're not ready. Recognize when you need a break. Recognize when you need a change. And take care of yourself. And if you do, then you can take better care of your patients. Alrighty, more responsibilities of the nurse. The nurse, through individual and group collective effort, establishes and maintains and improves the environment where you work and conditions of employment that are conducive to safe, quality health care. Oh my goodness. Nurses do this? Isn't that administration's job? Isn't that the doctor's job? Who sees the workings of a hospital better than the nurse or any health care? Who? The CEO of his office? The housekeeping staff? Maybe. But nobody sees it. Nobody sees it more than a nurse. That's what you do. You do everything in the hospital. Who gets everything done? Who gets it done? Nurses get it done. Doctors write orders, but nurses get it done. Who evaluates the patient? Evaluates the interventions. Who does that? We do that. Right? So, if you see, how many people have seen something you think is ethically off in your rotations? Everybody raise their hands. I see one over here. Anybody else see anything you think is ethically wrong? Here you go, let's hear it. Come on.
Your patient, tell it.
The G-rated version, guys.
A girlfriend in the room of her boyfriend's kind of like a vegetable almost, and she keeps placing her hand on his private because she says that's what he wants it.
Okay.
So,
But he can't tell you what he wants or what he's okay with, or...
Okay. Interesting. Everybody agree that this is an ethical problem for the nurse? Okay. What about caring for the patient's family needs? Is that her need?
We don't even know who she is, she just says she...
Agreed. I play devil's advocate here, but it's something you have to think about. Okay? I think that's pretty appropriate, but okay. How about scheduling? I've heard of nurses scheduling that I work, 5 12s in a row and I'm exhausted. Okay. Is that a condition of the employment? Is that conducive to safe, quality health care? Nope. What about working on a floor unit and you have 12 patients as the responsibility of the nurse? Is that conducive? Some states have ratio laws. California, 4-to-1 max. Okay? So those are things that you need to think about. Down the road, as you develop as nurses and move up the ladder perhaps in administration or change agents, these are things you have to recognize and avoid and fix. It's interesting, again. A nurse in all roles and settings, includes my role, your roles, wherever you are, advances the profession through research and scholarly inquiry. It never stops, and it shouldn't stop. I read journal articles almost every day, trying to keep up. I subscribe to many emails, and I get tons of things to review. And you can't review everything, but you can pick and choose. And whatever area of nursing you're working in, you need to stay on top of changes, current thoughts, and look into how to develop new things, new standards, based on what you're saying. You see things that you're doing wherever you're working, and you think that they could be done better, and you work to try to make them better. You see policies which are outright harmful, you better open your mouth. That's our job. That's our responsibility. Also, we talk about health policy. We influence health policy in a big way. Our nursing lobbies are powerful. The PAs in this country are very jealous of the nursing lobby. I hear it a lot. You guys have so much power. And nurse practitioners have independent practice in 24 states and the District of Columbia now. PAs have independent practice nowhere and really have no hopes of getting it anytime soon. It's also because we have a bachelor's degree in nursing, at least a master's in nursing. We have a lot more education than they do. They didn't like to hear this, and I've sat on the executive board for 5 years of the American College of Clinicians, which is a joint PA and NP. I'm very supportive of PA, but they don't have the nursing background. The nursing education is a wonderful thing. Doctors don't have it. It's a lack. And perhaps in my area of health policy, I like to see physicians have to do a rotation in nursing just like they rotate through surgery or emergency medicine or whatever. It would benefit them immensely. Most doctors will tell you as students or as resident doctors that they were helped immensely by nurses who didn't let them make mistakes, who educated them when they were willing to listen. And that's our job too. And that's policy. Change it. Wouldn't you like to see doctors rotate as nurses? Just doing changing the bed linen with an occupied bed.
Right.
Wiping some butts. Right? Bedside care. Spend all day long with a critical patient and see all the care that goes into it. Anyway, that's areas that I push in. And I'm all for independent practice. How many people know that there's bills before the House and Senate of North Carolina to get independent practice in nurse practitioners right now? How many people know this? One. This is local, big news in this state. We've worked for years to get to the point. We finally got Republican sponsors, and we're close. But here we have nursing students. We need to talk to your instructor about this. Talk to your senators. Talk to your state senator. Talk to your local representative. Tell them what you think. We vote. We vote. And the more they hear from you, the more likely they are to listen. So anyway, that's out there. I strongly encourage you to look into that, please. We're close. We may get it this year. Anyway, health policy. How many people think that nurse practitioners should have a supervisory position? Good deal. Okay. 8, collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. We've gone extremely political in this version. What do you guys think about this? There's a lot of debate about this point. Very interesting. I'd like to hear your thoughts.
I think collaboration is a good thing. I mean, there's always more than one way to do things. There's always more than one, you can always get another opinion on how to do something. What you think is the patient's best interest might not necessarily be the best interest of somebody else.
How is nursing protecting human rights and reducing health disparities? Is that nursing? Human rights. How can nurses help protect, collaborate with others to protect human rights? How can we do that? Is that a nursing point?
You can educate educate them on what's going on with them and giving them their rights to know what you're doing and what their treatments are and
Okay,
not leaving them in the dark on things.
and that's true, you need to do that. Is that human rights? Is that healthcare rights? All right, and reduce health disparities. What's that mean?
Help to give resources to people that need it the most, that don't have the resources to know where to go for things, or they might need health care and they're not able to get it right now.
What type of populations are we talking about that might have health disparities?
Vulnerable populations.
Hmm?
Vulnerable populations, those that are homeless or they don't have health insurance.
Low insured, no insured, okay. And that's what we always think about, the poor, the uninsured, the uneducated. I did a recent paper on, again, after conversation with, in the public schools about what the local public officials, school officials thought about what they saw as their biggest health concerns. And in the elementary school setting, their concerns mental health and the pediatric patients. There's a population. What kind of rights do they have? And then we talk about health disparities, and this is where the coin gets flipped. You have to look at the haves and have-nots. It is almost impossible to get people, the middle income and the lower income people with insurance. I'm not talking about Medicaid. I'm talking about paid insurance. They cannot afford psychiatric care for their children or psychological care. They cannot go once a month for ADD medication. They can't afford it. The assessments that are done by the psych people, they avoid doing those patients, and they fill their roles with Medicaid patients because Medicaid pays for it. It is a health disparity in a way you would never think. The insured, the Blue Cross, the Medcost, the Cignas of the world, can't afford psychological care for their children, whereas Medicaid, it's free, and they get the assessments. So when you think disparities, look at the whole spectrum of disparities. And that's something, I hope I planted a little seed there. It's not one way, it's always two ways. This was news to me. I was going, wow, wow. So it's out there. Disparities work two ways. What type of insurance? That middle-of-the-road person that works, the hard-working, minimal insurance person is